Hi,
Thank you.
Frida. Hi, everyone. I'm sorry I was having trouble getting in. I don't know if anyone else is having that issue.
Well, we have got people joined us today, I'm delighted to say, and thank you everybody who has joined us today for the webinar. My name is Georgina Grell, and I am the publisher for the Animal Health Portfolio at CABI.
Hello, I'm Serena OJ. I'm an associate publisher focused on public health. And also I want to apologize that we've been 2 minutes late. Sorry for that. So Georgina and I both overlap in supporting CABI's One Health Knowledge Bank, which is presenting today's webinar. And so the One Health Knowledge Bank is part of CABI's integrated One Health resources, including One Health Cases, which presents really good educational hands-on One Health projects or research in action, and CABI's One Health Journal, which is a new open access journal that we have actually one of the editorial board members for, Lisa Crump, who will be moderating, is here. And that's really good in stressing the interconnections between humans, animals, plants, ecosystems, and their shared environment in a truly interdisciplinary way. And if you're wondering about who CABI are, CABI is a not-for-profit development-led organization. We're supported by a publishing division, which is where myself and Georgina operate from, and a scientific research base, which you might hear a bit about as well today.
So CABI has been operating in some form for over 100 years, and profits from the publishing arm support our international development projects that are improving lives worldwide by providing information and applying scientific expertise to solve problems in agriculture and the environment. We have many projects touching on sustainable development goals relevant to today's debate, such as no poverty, responsible consumption and production, and climate action. Our publishing department provides a wide variety of products beyond One Health, of which there are several searchable collections relevant to today's talk, including CABI's Nutrition and Food Science Collection, the Global Health Database, PetMed Resource, and our Animal Science Collection. This webinar was inspired by the work of Francis Newby, who is speaking today. He was a PhD student of our editor-in-chief, Jakob Zinstal. It will be available on demand via the One Health Knowledge Bank, and I'm happy to hand it now to Lisa Crump, who is our deputy editor.
So yeah, a warm welcome from my side. I'm based in Switzerland, and I'm serving as the deputy editor of CABI Digital One Health Products. And I take a main leadership role with CABI Cases, and I just want to put a plug in there for those of you that are listening. If you haven't had a chance to look through them, the main idea with cases is that they are focused on One Health implementation, so the practical lessons that are learned. So I hope that you'll take a look through that. And without further ado, I'm going to jump in because I know we need to keep moving to stay on time. And we do want to leave an opportunity towards the end after the presentations for those of you who've joined as participants or as listeners to ask questions. So feel free at any time when the presenters are talking to post your question in the chat, and we'll come back to it. At the end, we have allowed about 15 minutes for questions. We'll ask you to save them until the three presentations have been run through. So I'm happy to introduce to you three speakers today. Firstly, Francis Newby, Dr. Francis Newby, as Georgina mentioned. He is currently at Friedrich Loeffler Institute. He's a postdoctoral researcher. I know Francis because he did his PhD work with our unit at Swiss Tropical and Public Health Institute. So I'm very interested to hear more about his thesis work, which was based on livestock farming and farmer mental health. Secondly, we have Dr. Simon Doherty, he is at Queen's University Belfast. He's a senior lecturer and trustee on the Ripple Effect Group Board, which is an initiative that's supporting farmers in Eastern Africa. And finally, Dr. Christine Aloki, she is working with CABI as a communication and extension scientist, and she's leading a project called Joint Crop and Livestock Services for Smallholder Farmers based in Kenya and Uganda. So I think it's a really interesting lineup, and certainly, mental health is an important aspect of the human health sector. And I think maybe it's from where I sit, I don't know, but I will venture to say that I think it's a bit of a neglected area, certainly in One Health. So I'm happy to bring it up today. And I'm going to go ahead and turn the microphone over to Francis to take us through. We'll have 3 10-minute presentations and we'll go right through. And then, as I said, a time for questions. So Francis, you get 10 minutes. I think I'm giving you maybe an extra 2, but it'd be great if you stick to the 10. Over to you.
Thank you very much, Lisa, and good afternoon, everyone. Good morning, depending on where you are, and maybe good evening. I hope you can hear me clearly. Okay, perfect. So my name is Francis, and I am a postdoctoral fellow of Afrique 1 based in Cote d'Ivoire. I also currently work as a scientist in the Frederick Loeffler Institute, as Lisa had already mentioned. So today I would give you a little talk, which is really part of my research, which focused especially on finding the linkages between the health of animals that farmers keep and the well-being of the farmers. If you can go to the next slide, please. So yes, livestock really contributes immensely to the lives of many people and households in low and middle income countries, particularly in Africa, where farmers are able to earn income from the sale of the animals they keep. And it's estimated to contribute about 30% of the total productivity within the agriculture sector in many of these countries. The income generated, livestock that are reared also support household as a food resource, and thereby contributing to public food security, especially when also farm animals are supporting in tilling of agricultural land, which all contribute to crop productivity, but also then the livestock products contributing as food resources. And then the nutritional value of livestock products like meat, milk, and eggs, which are really essential for the provision of protein in the diet of particularly children and women in low and middle income countries, are also very important for meeting the health needs of this population. Sometimes farm animals also do serve as companion animals to their owners, providing other social benefits. Next slide. So, however, these benefits from livestock production have been threatened by the high prevalence of infectious livestock diseases, which really affect the productivity within the sector and threaten food security and well-being of farmers. So in many of these countries, there is frequent reports of outbreaks within the countries. Can you press again, please, Lisa? And these reports are partly attributed to underinvestment essentially within the veterinary system, which affects service delivery and limits access to quality and professional veterinary services to farmers. Additionally, you also have a low utilization of preventive services on the part of livestock farmers, who then perpetuate the problem of these diseases. Next slide. So consequently, you have a high prevalence of these diseases, which is estimated to affect on average 1 out of every 10 cattle which die from these infectious diseases. And when you look at the the cows. This is about 2 out of every 10. It's also estimated for small ruminants that 2 out of every 10 adult goats and sheep are lost annually to diseases, and it's about 3 when you look at the kids and the small animals for the farmers. And so these losses really have negative consequences on the livestock sector. You have the decreased productivity of farm animals, where meat and milk production, you have poor body conditioning, which essentially reduces the outputs that farmers should be expecting with the inputs they put into rearing the animals. You also have a big problem of antimicrobial misuse, where the high burden of diseases is pushing farmers to resort to treatment of diseases without professional veterinary inputs. And so providing the risk where you have the introduction of high-risk animal products into the food chain, which could then affect public health. There is also a high burden of a disproportionately high burden of mental health issues among farmers, especially when they lose their assets. And so next slide. The goal of my research over the past 5 years has been focused on identifying the factors that, next slide. Yes, thank you. To get evidence on how the health of animals impacts on the well-being of the livestock farmers, but also to contribute to strengthening the health and food system to be able to deliver the expected benefits that would improve the livelihoods and also enhance the health of farmers and the animals that they keep. Next slide. So today I would present to you 2 studies, which the first one being the study in 2018, which was my master's studies, where we tried to identify what factors were causing livestock losses and how could this be linked to the mental health of farmers. And then in 2021, we delved a little deeper, expanding the scope, looking at more animals, but also more areas within Ghana. Next slide. Yes, next slide again. So for these studies, they were both conducted in Ghana. Ghana is a country in West Africa with a population of about 31 million people. In Ghana, agriculture is an essential part of the economy. It contributes about 20% of the gross domestic product. And the livestock sector accounts for about 15% of this share. Livestock that are mainly reared are poultry, cattle, sheep, and goats. So in this particular study in 2018, we focused only on cattle farmers. And we considered 2 districts that lie in the northern and the southern belt of the country. So as you can see in the map, the Bunkrubu-Yoyo is in the northern belt and the Korea-From Place South district in the southern belt. These farming zones have different weather conditions that could influence the rearing of animals, but also the sources of losses that were of interest to us. Next slide. So in this study, we sought to answer the question, what were the main sources of losses for farmers and how this influenced the mental health, focusing on livestock farmers rearing cattle. So here we conducted surveys among about 290 livestock farmers, and also key informant interviews with some of the farmers as well as the veterinary service providers. We assessed mental health in this study using the depression, anxiety, and stress scale. And in our analysis, we looked at the relationship that exists between the proportion of heads lost and also trying to find the best fitting model that explains the well-being of farmers. In our interview transcript, we also did thematic analysis to be able to identify the factors, and we try to link these two results together. Next slide, please. So overall, our findings from this study show that more than 84% of farmers, cattle farmers in Ghana, had reported losing some cattle within the study year of interest. And about 90% of these farmers reported losing their animals to diseases. And these other factors that were also accounting for losses were thefts and also pasture shortages linked to climate variability, where there is inadequate rainfall, and also conflict plus other factors. And in our interviews, if you can please press again. So this is a quote from one of the farmers, which really points to the impact of diseases. The farmer here is reporting about the contagious bovine pneumonia, which is a disease that has been frequently reported in the area. And he says that when it enters the head, it takes time before the disease leaves. And it's not easy. If you don't take care, you lose a lot of your animals. So here he illustrates a farmer who lost about 2/3 of his head to this disease. Next slide, please. And then in our models, we see a consistent negative impact of the proportion of animals that the farmer loses to these diseases throughout the what that explains the well-being of farmers. Next slide. Then in some of the interviews, we also observed that the impact also goes beyond the mental health that we assessed with our tool. So farmers also reported having that the livelihoods is affected. They become depressed, but also they threaten to commit suicide. Some even report physical symptoms of high blood pressure and others, which they attribute to the significance of the losses that they suffer. Next slide. So based on these findings, in 2021, when I designed a project for my PhD, the goal was to delve a little deeper into these diseases that farmers were reporting, because some of them had effective interventions, but to also identify within the sub-Saharan African region which interventions had been applied and which are effective and provide good returns on investment that farmers could then take advantage of. We also sought to identify the main barriers to using this effective intervention, as well as to provide a bit more evidence on other aspects of well-being that are affected by losses that farmers suffered. And so in this follow-up study, we expanded the reach a bit, as I mentioned earlier, including 3 districts that lie within 3 of the main livestock producing belts in Ghana. So you had the Mion district, which is in the Savannah belt, which is the dry belt in Ghana. You have the Pro East district, which is in the middle transition belt, and the Kwewu-Afram Plains South district in the southern belt, which is mainly the forest. Next slide, please. So I will focus on only one of the studies that we conducted in the PhD, which is related to well-being and impact of losses on farmers' well-being. So here, our interest was to estimate the average change in the well-being of a farmer that could be attributed to the losses that the farmers suffer. And so we assessed well-being. We assessed well-being. Next slide. Can you press again? Using the WHO quality of life breath tool, and then we then determined the losses as the proportion of heads lost to diseases. And in our mixed effect model, we try to estimate how this is associated with the well-being. And so overall, we found that about 20% of the herd were lost to different factors, and half of these losses were due to diseases. On the well-being scales, our farmers scored about 65 out of 100, which was somewhat low. Next slide. And when we did the modeling analysis, we see that farmers with severe losses tend to have lower well-being scores compared to others with low level of losses. And this was consistent throughout all the domains of well-being that we assessed. And particularly for physical and psychological well-being, this impact was statistically significant. Next slide. So our model predicted a difference of about 8 well-being points between a farmer who lost no animal to one that lost a significant portion of the animals. So what does this mean? Next slide. We can say that in conclusion, the farmers in Ghana experience multiple stressful events that affect the livestock production, and diseases are the main factors that account for many of these losses. They have a significant negative impact on the well-being of farmers, both on the physical and psychological domains. And there is therefore a need for increased investment for more effective disease control. Next. And to achieve this, we would also be able to then provide a good returns on investment for the household and the country, and also for better well-being of these livestock-dependent populations, which will go a long way to improve food security and public health. As you can see, there are different factors that are affecting losses, and so there will be a need for a transdisciplinary approach involving multiple sectors, but also the farmers as well as the service providers to be able to reach their desirable outcomes. I would like to thank you very much for your attention, and I'll be ready for your questions when it's time.
Thank you so much, Francis, for the interesting presentation. I guess what's really shocking to me is the high percentages that you're reporting in your work. In the interest of time, we're going to press right ahead. And so I'd like to introduce next Dr. Christine Aloki, and she is going to give us a 10-minute presentation. Christine, the floor is yours. Are you actually based in Africa at the moment? I'm not sure about that.
I'm based in Uganda, East Africa.
Okay, thanks for clarifying.
Yes. Yes.
Please go ahead. The floor is yours.
Thank you. Frida, are you sharing the slides? I don't know whether she's heard that. Are you sharing the slides from your end?
I'm sharing the slides.
Okay. Thank you. As introduced, I'm Christina Lokit. I manage CABI programs in Uganda, and I'm also a communication and extension scientist. And so I'm sharing some of the insights from a project that we are implementing in Uganda and Kenya. And we are looking at the joint crop animal services for smallholder farmers in East Africa. We are exploring the One Health benefits, operations, and lessons for scaling out. So we are doing this in Kenya and Uganda. Next slide, please. It's frozen from my, okay. I would just like to take you through the photograph. There is one of the joint clinic sessions, and you can clearly see that there is a farmer seated right there talking to a paravet with his animal, his goat. But you can also see that on the other side of it, there are staff from both the veterinary animal production and the agricultural side. And there are samples also that farmers have brought of a banana. And that is the typical setting of a joint crop animal clinic. Normally they share one table, or they can sit aside, and there is usually a waiting area for farmers. So that is what we are piloting in the two countries. Next slide, please. So why the joint crop livestock services? The idea evolves from the plant clinics in a number of countries that were assessed, and we found that many plant doctors reported that farmers regularly ask for advice on animal health and animal husbandry issues. Where do I go after I have solved the issues of the plant? Who can I go to? And of course, as we see, this is not a surprise because most smallholder farmers rely on mixed production systems and so need advice of both crop and animal services. Next slide, please. So the integrated cross-sectoral services, we are exploring the One Health benefits by making better use of existing resources and capacities. Resources are a big constraint all over, but also looking at creating new synergies and adding value to the services. And clearly from the diagram that we see there, you see that there are crop services, which are looking at crop and the production issues. And we also have the animal specific issues. But then within that, we know that there are One Health issues that arise. There are issues of mycotoxins. Aflatoxin is a big issue in East Africa. The issues of misuse of both animal and plant drugs, issues of contamination and poisoning. We also have issues of zoonotic diseases that are on the rise and microbial resistance. And of course, issues of crop water, soil and manure management, and poor animal nutrition. So those are all issues that are integrated, and we felt that piloting this approach might help us to get solutions to solve such issues. Next, please. So this is an opportunity to innovate using existing resources in a new way, but also seeking new synergies. And we are aware that general extension services are understaffed and under-resourced. The coverage is low, but services are often organized along sectors and disciplines. You find that the veterinary staff are on their own, the public health on their own, and agriculture on their own, and yet there are synergies that we can ride on within the various staff. So joint crop livestock clinics offer promises to fill some of the existing gaps. Next, please. Some key lessons from our work since 2021 in the two countries is that through these joint clinics, there has been increased farmer reach. Farmers get more tailored advice for their needs and including more vaccinations because they get crop, animal, fisheries, public health officials, environment officers all come to these clinics and they seek advice just beyond pests and diseases. But there is also enhanced accessibility for women because the clinics are mobile and held in the villages. This makes it easier for more women also to attend given the closeness. And it also includes farmers who may not have sought advice if these clinics were not available in their communities. And also we are aware that women usually rear or own some livestock or ruminants and provide a lot of care for the livestock in the family. So this is a valuable advice to them. There is also increased uptake of technologies, and that because of the one-on-one consultation, the farmers are also able to be linked to input providers, and sometimes within the districts and the counties in Kenya, based on the records that are seen, they are able to plan for some of these inputs to be delivered to the farmers from the government resources. We've also realized that there's an element of cost efficiency because they share the costs among themselves, leading to greater efficiency. You find that if the staff go in together, they share the transport, but also the time that they are able to sit and deal with all those farmers reduces the cost that they would have to ride from one place to another. And there is the increased cross-learning, better understanding of interconnection of plants, animal, and environment among farmers and staff, and farmers have opportunity for cross-learning among themselves and extension staff as well. This is providing a very good entry for One Health action in the communities. Some of the One Health issues that have come up in the two countries include issues of aflatoxin, misuse of the drugs, both veterinary and plant drugs, issues of antimicrobial resistance, and then issues also of eating meat that we should have not, that is condemned. All those are issues that are coming up from this project. There is also improved national surveillance because of the village-based approach. you find that the data, the information that is received from the farmers provides the staff with the very good records for fast action, and therefore this improves the surveillance system. And sometimes you find that a problem that could have spread across many villages or districts is contained within a village. There is also improved multidisciplinary collaboration, as mentioned earlier. The various staff from the various sectors coming in together get to understand a lot more about the One Health issue and how they can support each other to actually deliver a better advice to farmers. Next, please. So some areas for improvement in One Health approach. There is a need to enhance collaboration and coordination, improve the coordination between the disciplines at both the lower level, the districts and the counties, but also at the higher ministerial level. So if we are working very well at district level in a joint clinic, this should be able to escalate further to the different ministries level to be able to improve that One Health delivery of services. Then institutionalize the One Health aspect, incorporating One Health principles into the respective departments' annual work plans is very, very critical, because without doing that, then it would mean that other departments cannot ably participate in this because of the resource allocation that is required. And also there is a need to improve access and affordability to laboratory services. We know that many of these cases need to be tested to confirm, and the accurate diagnosis is very critical, both for the One Health issue and the non-One Health issue. So because of that, you find that sometimes the data, the services are lacking, and so the staff have to use some proxy indicators to be able to provide farmers with diagnosis. And also there is a need to develop sustainable and simple data systems for us to be able to say what are the One Health issues in the community or what are the key challenges of farmers. We need to have a data system that cuts across, but this should be very simple way that the staff can easily use it, and this can then be able to feed into the national database to support the decision-making process. We also have the need for committed and sustainable funding. That is very key. And this goes beyond just the zoonotic cases, because farmers' issues on the non-zoonotic cases or chronic cases like feed safety and many others affects their animals also a lot. And if this is not dealt with, then this also affects farmers' well-being. And so addressing One Health issues beyond zoonotic cases is very, very key to focus on issues like feed safety, misuse of those drugs, as we mentioned, and aflatoxins, and doing it all together. So there is also a need to develop and implement One Health policies. You'll find that even where we have One Health being implemented, probably I'll give an example. In Uganda, we have a strategy that is under revision, but this has not yet got difficult to deal with issues of resource allocation. Next, please. The next one. Okay, that one. How do we align the goals of mental health support, food security? No, previous. The previous slide, please. How do we align the issues of mental health, food security, and safety with sustainable livestock farming? And I would like to bring to your attention that when animals are healthy, farmers are happy people, as mentioned by the previous presenter as well. So farmers' food security and safety is primary. Farmers have to attend to livestock better because they have to deal with food for their own families and water for human and livestock. They also need to be able to promote accessible and affordable preventive animal care services, such as vaccinations, deworming, and the bureaucratic systems that comes with some of this brings a frustration to farmers. I'll just give an example. Uganda, we are very fresh from foot and mouth disease, And there was a lot of back and forth. The farmers were very desperate for the vaccines, but the vaccines were not in the country and had to be procured by the government. And of course, this all took time. So these all affect farmers' well-being, and widely promote animal welfare practices to improve animal health. So we should not wait for the animals to be sick, but also the welfare practices improve the productivity of animals in general without necessarily waiting for sickness. And encouraging mechanisms that promote cash flow from livestock farming, crop production, because the cash flows are very key. We have scenarios where farmers have a lot of animals, which is a live bank to them, but how do they manage that system so that they are able to actually reap from the cash flows accruing from them? And also given that the resources, the resources for livestock rearing and all that is a challenge. And investing in breeding and provision of other inputs, including water, low reproductivity rates to discourage farmers, because if the animals are not doing well, then it's not nice. So we felt that joint clinics provide a one-stop center for farming solutions to farmers in those scenarios. Next, please.
Christine, if you can just wrap up in 1 more minute so that we can stick to the time, I would really be grateful. Thank you.
Thank you. So the policies that we need to look at is to provide adequate and accessible quality extension services, enforcement of regulation and inputs, access to quality inputs, and promote the mindset change and business models within the livestock farming communities to be able to realize the benefits, and then enforce regulations against animal theft, which is a very big problem in the communities currently. The last slide. Strengthening of existing cooperatives and farmer groups to be able to address issues that could be done communally, and using a gender lens in livestock production and management, but also create an enabling environment for supportive services and address issues of climate change and population growth, which all affect the farmers' mental well-being. Thank you very much for listening.
Thank you so much. It's a really information-dense subject that you've touched on, and I realize we've given our presenters a challenging task when we only allocate 10 minutes. So I'm going to quickly move on to our last presentation from Dr. Simon Doherty, and he is going to tell us, I think, a little bit about some initiatives supporting farmers in East Africa. The floor is yours, Simon.
Thanks very much indeed. I'm just going to try and share the right screen here. A bit of help. Here we go. Okay, hopefully you're able to see that.
Yes,
so listen,
we have it.
Thanks so much for the opportunity to speak to everyone here today. I'm going to talk a little bit about the work of Ripple Effect. So I'm based here at Queen's University in Belfast, and just really quickly a bit of my background. I'm a vet. I worked in farm animal practice in Scotland and here at home in Northern Ireland. I've worked across diagnostics, disease surveillance and research. I'm actually a certified aquaculture vet. And then I did some work for government, and I'm a past president of the British Veterinary Association, but I'm now based at Queen's University in Belfast. But I'm really here today in my capacity as a trustee, ambassador and veterinary advisor to Ripple Effect. Now, why did I give you that background? It's not really just so much sort of self-indulgent walk through my career, but really what I wanted to highlight was that when we're thinking about animal health and farmer well-being, really we need to think about, you know, the general principles of animal health. We need to be able to think out of the box. We need to be able to think with a global context. There's no point in us being completely siloed. And for me to use my knowledge of livestock work in Scotland or in Ireland, you know, we need to be able to think in the global picture. As you've heard from the previous two speakers, you know, One Health, we need to get One Health into action. I was really pleased Christine talked about One Health in action, and we need to get very much beyond thinking about just the links between people, animals, plants, and their shared environment, but it's very much about how we create action coming out of that and taking policy or strategy and really putting it into practice. So when we think about One Health, I still quite like this definition. There are probably hundreds of definitions of One Health, but I still quite like this one from a few years ago from the One Health Commission, because it brings out that collaborative, multi-sectoral, transdisciplinary approach that you've heard from the previous speakers. It brings out the local, the regional, the national, and the global levels. So we're obviously thinking today, you know, we've got people from all around the world on the call here today. But then coming down to national and regional level about control programs for things like foot and mouth disease, as you've heard, but then coming right down even to local level, and that's kind of where we work in Ripple Effect. And recognizing those interconnections between people, animals, plants, and their shared environment certainly is something that I think we can all sign up to. The little cartoon up on the right-hand side, we're probably all quite familiar with, but let's just think about it in terms of the two-way arrows, okay? Francis, when he was given his presentation, was very much talking about the link between animal health and farmer well-being, but that is a two-way relationship. Quite often we think in terms of, well, if we've got healthy, happy animals, we'll have healthy, happy farmers. But it works the other way too. If we've got healthy, happy farmers, the likelihood of being able to improve health and welfare of our livestock is also increased. So 36 years ago, really kind of came on the back of a chance meeting between a bishop from Uganda and a group of dairy farmers in the southwest of England here in the UK, that there was a mismatch between the farmers being asked to give up their livestock because of, you know, excessive production across the European Union, and a need, you know, in Uganda for you know, still millions of people in the world that were starving, and so almost as a kind of bit of political statement, we started off as Syndicai, and a bunch of in-calf heifers were shipped from the UK to Uganda in 1988. And so started the roots of what became Syndicai and is now Ripple Effect, because it very much kind of recognizes that we're no longer just about livestock placement. In fact, we actually do very little livestock placement now. But if we jump forward to where we are now, these are the 6 countries that we work in. We've got a hub in Nairobi that we do a lot of our work from. We've got an office in the UK and an office in the United States, where, you know, which are largely sort of fundraising and strategy based. But we do a lot of our work now from the hub in Nairobi. And I was actually was there just 6 or 8 weeks ago, and the opportunity to do some work with our staff there. But these are the countries that we work in. Now, the point of putting that map up was to kind of show you the diversity. You know, again, there isn't one rule that fits all. So in the top of this photograph, when I was in Nairobi 6-8 weeks ago, there was very, very severe flooding. But in contrast, the 2 photographs at the bottom are the photograph at the bottom on the left-hand side is actually in Kenya, where we'd seen crops being the rainy season coming late, but by the time crops were then put into the soil, and fodder and forage and production for livestock was put into the soil, it was just washed away before it really had an opportunity to fully develop. And again, setting that against, on the right-hand side, one of our farmers in Zambia, which is a country that's facing extreme drought. So what we're saying is, you know, it very much brings the One Health concept into context and thinking about the environment. It's about people, it's about animals. Yes, it's also about plants, but it's about that shared environment, and that shared environment is changing. So the extreme weather conditions that we're seeing, particularly in equatorial regions, is something that we all have to take account of. So the aims of our programs are then to look at challenges around lack of education, low self-confidence, isolation and prejudice, and gender barriers. And so therefore, I very much kind of consider our work within Ripple Effect to be One Health in action. We have a big emphasis on community. We have an emphasis on equality and inclusion. And that includes elements related to gender empowerment, but it also relates to inclusion of members of the community who have physical and mental health additional needs. We have an element relating to health and hygiene. And a lot of the areas that we work in, there may be very high areas, high levels of things like HIV/AIDS. So thinking about the health of and well-being of those people, as well as the implications around health and welfare of the animals. And as you've heard, the example of foot and mouth disease. We work very much around integrated farm systems, and particularly in 2024, there is an increased emphasis on, how much emphasis should we be putting on livestock? But we know that in the smallholder farming situation in some developing countries and certainly in areas in relation to sub-Saharan Africa, that actually, as part of a sustainable development approach, the integration of plants, animals, forage, needs to be taken very much into consideration. And enterprise is also a really important part of the work that we do as well. Yes, we want to improve the nutrition of smallholder farmers. We want to improve the nutrition of the communities that those smallholder farmers are living in. But we also would like them to have some produce that they're able to sell, bring an income to the household, help to provide an education to their children, and so on and so forth. And another really important part of One Health obviously relates to things around partnerships. And that's partnerships within that community setting, but it's also partnerships with other NGOs, it's partnerships with government. So for example, we work very closely in at least 2 or 3 of the countries that we work in with the Brook. It's an equine charity, and has more of a focus on working equids, so horses and donkeys and ponies, whereas we work more on the livestock and horticulture side. But those partnerships are really important. Equally, in Ethiopia, we've got fantastic partnerships with the government extension workers, and again, working and understanding the roles, the relative roles of people, is also a really important part of that. So, for example, in Ethiopia, the government extension workers do all of the artificial insemination of the livestock, and we work very much alongside them. But what they'll take away from our extension workers is some of that knowledge that we have, and then other areas that those government extension workers are going into, they will take some of our training methods and help to spread the word in that respect as well. So it's a very much a kind of mutually beneficial relationship. Thinking specifically about the role of livestock, because that's what we're talking about today. Yes, they're a source of nutrition. We have to remember that in a lot of countries, they are an economic asset. They have social capital, but they help to build resistance. And you can see we've got a couple of quotes down at the bottom, which indicate not just the usefulness, the practical usefulness of owning livestock in terms of being able to produce milk or eggs in the case of poultry, or lamb or goat or beef meat, but they're also then they using the dung and the urine to as a source of nourishment for the soil, which can in turn help to improve resilience in terms of improving soil quality and reducing the likelihood of topsoil getting washed away and things like that. But naturally, ownership of livestock can help to build hope and help to build resilience. And they really are a source of confidence. And just a little spider diagram at the top, the yellow line is indicating some of the factors that we look at. So looking at the improvement then between the yellow line and the red line, particularly around things like hope and satisfaction at the top, the improvement in nutrition security index around the left-hand side, but also things like social inclusion, financial security, and so on as well. So very much that kind of the piece around livestock and the link between humans and their livestock is really important, and improving the well-being then of that. One of our old mission statement actually used to be about providing the hope and the means to help people that we work with secure their own future from the land, and that was shortened then to hope means future. And that is still quite a useful little sort of acronym, I think, for us to think about this sustainable development work involving livestock and you know, looking at things like resilient fodder production to feed those particularly dairy animals that we work with. Just by way of a little example of one of the methodologies that we work in, I don't know whether anybody here is familiar with cow signals. It was originally developed for, I suppose, Northern and Western European dairy systems by two vets in the Netherlands called Jip Driesen and Jan Hulsen. I did some work with them a few years ago, and out of that, the guys produced cow signals basics for East Africa. Now, it was largely based on systems within Tanzania, but it works around this cow signals diamond, thinking about space, feed, water, light, air, and rest as being the key functions in relation to livestock health. But of course, we can take the cow signals diamond and almost apply it to people as well. You know, but again, just sort of thinking about where we have healthy animals, we tend to have farmers that are in much greater well-being, and you've heard some of Francis's work in that respect as well. So just as I start to wrap up and we head towards the questions, I just want to give you a couple of sort of points of reference. Have a look at the Ripple Effect website. There's a lot more information that I can cover in 10 minutes in our annual reports and impact reports and position statements. But I'd also like to thank staff at our Africa Hub, particularly Fred and Mishark, for their input to this presentation. And also draw your attention then to Action for Animal Health and this report, the case for investing in animal health to support One Health. Again, a really, really useful tool. Action for Animal Health is a collaboration between a number of NGOs, including Ripple Effect and including the Brook, looking at that sort of link between animal health and One Health, you know, across the world. And I would very much encourage you to have a look at that. So with that, I'm going to wrap up my presentation. I'll hand back to Lisa to lead us into a Q&A.
Thanks so much, Simon, for giving us a quick dip into the really local level. I appreciate that. I know it's really not fair to ask you for 10 minutes only and then hold you to it, but I did want to get to a few questions, and we do have one from the audience. It's posted in the chat. If you can see that, the question is, how does a rabies outbreak in goats in a rural community caused by stray dog bites impact farmer well-being and livestock health? And while that's not necessarily been touched on by our panelists today, I'll swing it to you, Francis, and just ask you, did the topic of rabies come up when you were interviewing your farmers in Ghana?
Thank you, Lisa, and thanks, Therese, for such a nice question. No, not directly, but we know in these areas that farmers also keep dogs, so it's definitely a problem that would need to be looked at. But in general, I would say that yes, when it comes to dog bites, we have pretty good idea which population groups are at higher risk of dog bites, and so in rural communities, I believe that having dogs biting goats that then die would also contribute to losses that farmers suffer and could contribute to losses in well-being.
Yeah, thank you very much. Certainly an awareness, community awareness question if you're having an outbreak. So I would like to then ask a question of you, Christine, and you have addressed it to a degree. My question was, what policies or interventions could be implemented to improve the mental health of livestock farmers in Africa? And like I say, you touched on it. The specific question I have for you is, could you share with us in particular one next step intervention that you might tell decision makers if you had the microphone and you had a group of decision makers, what next intervention would you tell them is most crucial to inform policy around this issue of improving farmer mental well-being? You had a slide that I found. Yeah, go ahead.
Yeah, one of the things that are very crucial is that there's a lot of misuse and cross-use of animal drugs and crop protection drugs. And so a farmer who is unable to access services is lured by anybody, and they buy these things and they are using them on the animals and doesn't really improve their animal productivity. So enforcing of those policies is very important, but also to really ensure that what is on the market is quality products. So that's one of the issues that I would really address.
Mm-hmm. Thank you for that. Simon, I can pass the same question to you. I was interested in your slide where you kind of summarized some of the lever points relative to One Health approaches. And I thought it was interesting that you brought up partnerships and enterprise. And they, to one degree, they seem a little bit, like different ways of addressing the same problem, one grabbing it by the head and one grabbing it by the tail. Would you have one particular next step or intervention that you think would be most useful to inform policy about farmer well-being?
Yeah, I'm going to say this maybe as a sort of educationalist at heart, but I think it comes down to education and training. I think where farmers have, there's a lot of hope and confidence and resilience is actually built up by understanding some of the methods that are available, and some of them relatively simple methods that are available. I think if we try and, I hate to use the term preach, but if we just get to in our educational approach, if we just kind of say this is the way that it is and that's it, but helping farmers to solve problems for themselves. So there's very much a way of delivering education. And to be honest with you, it's a mechanism that works for farmers here in Ireland. If farmers are thinking and have the knowledge to then develop solutions for themselves, that tends to be where there's the much greater impact. And I would very much sort of suggest that applies right across the board. And the same applies even to the question that you asked Francis as well, where you've got maybe things like rabies or foot and mouth disease or other sort of infectious disease of livestock. I mean, it's the education piece that comes with correct disposal of carcasses and things like that to stop wildlife reservoirs perpetuating rabies or foot and mouth disease or whatever, so the education has got to be key.
Yeah, and I think you've highlighted sort of a tenet of how we at CABI define One Health, which is that it has to be a participatory approach. And so we're discussing with the communities because the knowledge is there, and we work together in our efforts. I'm looking at the time, and I see that our time is up. Frida or Georgina, can you just we should finish on time, right? I don't have time for one more question, right?
I mean, if you have a burning question, we could quickly.
I guess the last burning question, and it's sent really to you, Francis, is just this idea of aligning the goals of mental, well-being with sustainable farming practices. Have you got just a one-sentence answer for us that you can leave our audience with that might inspire them?
Yes, definitely. For me, if we can protect farmers' animals, which are really valuable resources for them, one, we ensure that we support better livelihoods, but then we would have the leverage to ask farmers to keep animals that they can only sustainably feed with the resources they have. If we don't provide enough protection, then we don't have enough leverage to ask farmers to keep only animals that they can be able to reasonably feed with the resources they have.
Yeah, well, that's you've taken a complex, complicated circumstance and reduced it to an answer that in theory sounds simple. So I thank you for that. I want to thank all of you for participating today. And with that, I'm going to turn it back to Frida and Georgina.
Thank you so much. I really want to just say thank you to Lisa. She's always been really excellent in moderating these discussions, and I always learn a lot, and I've learned a lot from all the speakers. Thank you to Simon, to Francis, to Christine, for sharing really interesting points of view. And I think there's 3 different speakers today had all different points of view of the research, from Francis with the in-field experience of Christina, and Simon with what he's doing as an ambassador for the ripple effect. Has been really interesting. So just to let everyone know, I think it's been a question that's come up a few times. This will be available on the One Health Knowledge Bank as a recorded session. Someone asked about slides. That's down to the speakers if they wish to share them. But if you want to directly contact us, I put our email addresses as well in the Q&A, and you can find them on the website as well. Thank you all so much for sharing your time and joining. It was really good to see people from different places in the world joining the talk. So thank you all.
Thank you. Yeah.
Thank you all for joining.
Thank you.
Thanks for the
Thank you.
webinar.
Thanks very much.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye.